Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Dr. Carl Rothschild, a pioneering advocate of red light therapy, RLT, has dedicated his life to igniting the spark of vitality in others. His relentless pursuit of knowledge has yielded deep insights into what people truly seek in their health journey, leading him towards the groundbreaking domain of red light therapy. His solid foundation in science was built at Stony Brook University, followed by a doctorate from the Southern California University of Health Sciences. Since 1979, he has been serving the community of Los Angeles with his compassionate approach to chiropractic care, directing the highly regarded Westland Health Center. He also founded LipoMelt Technologies, or Trifecta Light, a company specializing in professional-grade red light therapy devices, including the notable Trifecta Light Bed. I am super excited for this conversation with Dr. Carl today because I am a huge red light therapy fan. So I'm very fortunate to have someone that's an expert in the field be on the show. So welcome to the show, Dr. Carl.
Thank you so much. Thrilling
Awesome.
to be here.
Yeah. Well, before we dive into specifics about red light therapy, I would love to learn more about your background and really more about your passion for how you got into red light therapy and the like.
So I've been a chiropractor for 46 years, started in around 78, 79, and I did well. I eventually had 15 practices, not all at the same time. I lectured all over the country. Now I don't have to go all over the country. We can do Zooms and things like that. Mm-hmm. About 25, give or take, years ago, I was introduced to red light therapy. And it was and I'm wearing my red light therapy shirt, by the way. Yep. I was introduced to it by a gentleman named, a medical doctor out of USC out here in California. His name is Chadwick Smith. And he introduced me to light therapy. I'm not saying I went into it without some skepticism, because he's telling me shine a light on somebody and you'll make a difference. It was hard to believe, but I tried it, and I got to say it revolutionized my practice. Then about 12 years ago, it was discovered that there's an element of red light. Now, up until that point, I was only using near infrared. Then it was learned that there was an element of red light that actually helped to shrink fat cells. And that's when I said, I think I want to even get more involved, and started in manufacturing, and with great results. I mean, we always wanted to have the best. We wanted to have top of the line for everything. There are people out there who are in manufacturing that don't know what they're doing. They don't understand the clinical or technological issues that are involved. And bottom line, about 4 years ago, there was this thing called COVID that some of you may remember. And COVID, practitioners were coming to us and saying, could you put together something that had less physical contact between the provider and the patient? And we developed the bed. I wasn't gung-ho about that, by the way. I liked what we were, up until that point, we were involved with lasers and pads, and we were right on the skin, and we knew with the bed, we would be off the skin. So, but we created the bed, and it was within a very short time after we started delivering these beds that we started getting feedback that told us that we were onto something. What we learned is that when you bathe the whole body at the same time with this miraculous light therapy, then you're going to get some results that are striking. Can I just mention, when I do my conferences or lectures and stuff, I do a what would you do question for people in the audience. I said, what would you do if Lewis called you up? And Lewis, who's a provider in California, he goes, I got this patient coming in tomorrow, and he's having heart attacks all the time. Like, if not once a week, sometimes twice a week. And 15 years ago, they implanted a defibrillator into his chest. And so that every time he died, it would zap his heart back to life again. He was a mess. He was dying. 15 years of that. And before that, he also, obviously he'd been suffering probably for 20 years. He was about in his early 60s, I would say, when I first spoke to this patient. But Lewis calls up, should I even treat him? And when I'd like to ask you, your audience and yourself, well, what would you do with that situation? In what you currently have, if you're a practitioner, with your tools that you have right now, would you take on somebody into your office who's having heart attacks regularly and nothing's helping him? What would you do? I'd like everyone to just think about that for a half a second. And then I said, being the brilliant guy that I am, I said, Lewis, let the patient come in, only treat him for 5 minutes, and stay in the room the whole time. That night after the treatment, this gentleman's name is Arnett. Arnett goes home. And first of all, that was almost a year ago, has not had a heart attack since. That night, his erectile dysfunction was no longer a problem. That first night, after just a 5-minute treatment, and everything is coming back to life. Over this year, his every organ, every gland, every tissue in his body is no longer suffering. And what would you do if you didn't have this miraculous light therapy? Now, let me tell you something. Chiropractors like toys. If I go to the average chiropractor's office, they got rooms filled of crap that they don't even ever use, and or stuff they do use. And I myself, I'm no exception to that. I had a lot of toys. So we played with hyperbaric chambers. We played with lights. We played with EMF or pulsed electromagnetic frequencies, or frequencies in general using microcurrent, or a whole bunch of different. They were all great at the time. I thought these were really fun. I had whole body vibration, spinal decompression, of course, all kinds of techniques in chiropractic, and they were all fine. But I had no answer for this Arnett thing. I mean, if the guy came in with heart attacks, I really didn't have an answer for that.
Mm-hmm.
Now I have an answer for all kinds of stuff. All kinds of stuff. I mean, we've had people talk about multiple sclerosis, Parkinson's, dementia, Alzheimer's. It just goes on and on. We've had people who are stage 4 renal failure, now not. We've had people with diabetics who need a lot less insulin, let's put it that way, than they used to. So it boggles my mind to think what my life was before and what it's like now. I'm going to be 72, and I get in the bed that I have in my home here 3 times a week, and I don't have any particular ailment. I don't want any ailments. Mm-hmm. Looking to jinx myself, but I don't want any conditions, and that's my way of staying as healthy as I possibly can. So if you're not getting in our bed now, I think you're making a mistake, but most people don't know about it. Yeah. And I've lectured and the other facilities and the other technologies that are there, they're nice. They're good. All the vitamins mm-hmm. and things. I'm not saying do the bed and then screw up the rest of your life. Eating smart, exercising smart, and the red light bed, that's what it's about. So
how does the red light bed differ from, say, the red light panels, or even the red light things you put on your face or your neck? How does the bed compare to those? I know you're going to say it's better, but can you tell me a little bit why it's better or how it's better?
Well, again, I used to use lasers. I used to use pads, and they were covering certain areas of the body. Absolutely critical. A few things. One, cover the entire body at the same time. So our bed is 6'8". It's going to cover you from head to toe. It's going to cover you left, right, front, back, inside out. So many cells are now exposed to this light energy, and that's what made the difference. We never got these kind of results with local stuff. And the things on the walls, listen, rule number 2, not only do you want really strong lights that don't get hot, heat is the enemy. If the lights get hot, it will dilate blood vessels, bring more fluid to the surface, block the penetration of light. It's self-defeating. That's the last thing you want. You don't want that. So what do you want instead? You want very strong lights that don't get hot. And that's been the trick. That's been the difference over the many years that I've been doing this, decades now. We've always wanted to have very strong without heat. When our patients get out of the bed, they're going to say it was comfortably warm, not hot.
Yeah.
If they say it's hot, then the settings were wrong. And we can customize both the frequency, so you can pulse the wave, which is very important to create resonating frequencies. And you can also customize the power. So if you've got a dainty little, well, let's say you have a 400 pounder and you have settings for them. Well, you're not going to have that same exact setting for this 90 pounder. It's not difficult, boom, 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 you have new settings, but you're going to have different settings. So you customize for the size of the individual.
Okay.
But the most important, another very important thing is you want the lights as close to the body as possible. So when someone brings our canopy down onto their body, it's on their body. There's no inches between. It's on the body. Not the weight of the canopy, which is 250 pounds, just the proximity, because we have these wonderful shocks, or called hydraulics, which allow the canopy to come down and you move it wherever you want it, and it will stay right there. So panels on the wall, that's fun, but they're not going to make the kind of differences we're talking about. Things on the face, that's great. Things on your elbow, I don't care, that's fine. You see things where people put their feet in a pad system, great. But if, as a holistic doctor, you want to cover everything. So if someone came as a chiropractor, before I was dealing with red lights and they had an elbow problem, you better be sure I'm going to make sure that their neck is good and their nerve flow all the way down to the neck is good.
Yeah.
So with the technology that most people do, especially in the medical profession, someone has an elbow problem, they go to the elbows expert and he with their elbow. Never mind what did that come from. Well, as a chiropractor, we're going to deal from everything from top to bottom, all over. And that's the beauty of that. So yes, the wall stuff, that's fine. It's okay. It doesn't do the kind of things we're talking about here.
Right.
The face mask is nice for the face, but with the bed, you're covering everything at the same time. So all those things are covered. So I just interviewed a relatively famous pole vaulter. Her name is Chloe. She's internationally acclaimed. She's only 23, I think she said, and the premier pole vaulters are about 25 to 30. So she's getting there, but she's still ranked very high. And we have a bed in a training center in in Seattle, Washington. And I told her, I said, you need, because her meet is coming up soon. She's going to be doing an international event. And I said, you want to get in the bed as often as you can now, because before the activity, people will get in and their stamina will be much better. I've had people call me up and say, thank you for making this bed, because I can now run twice as far, swim twice as far with less exhaustion. And then their recovery is so much faster. So Chloe, I said, get in the bed more often. And her issue is that it's so popular up there. They've got NFL players. They've got all these Olympic track runners, all kinds of stuff in this center there. That's hard to get in the bed because it's so popular. That's why I contact them about getting a second bed, most likely. But that's the beauty of this thing. It's going to increase their energy. It's going to reduce the likelihood of them getting injured in the first place.
Right.
So
how?
Did I answer your question? I don't mean to.
Absolutely. No, absolutely. Can you talk a little bit about how it actually works?
I can. And before we even go on, and I don't make a dime off of this, but I did write this book. Let me put it in there. Called Illuminating Healing. If you go to Amazon, you just get it. And it's 280 pages that I covered just about everything. And so you'll learn a lot from this. It's on Kindle. You can get it off of Kindle. Also, you can get it if you want to hear me talk for 8 hours, you can also get it as a audiobook. Okay,
Perfect. We'll make sure to include that in the show notes. We have the link here, so that'll be in the show notes, the link to your book.
Okay. So let's talk about how it worked. I think this is very important.
Yeah.
Some people, some people go, it works. Yes. It can't hurt me no matter what. It won't hurt you. That's all they need to know. But most people want to know a little bit more about it, especially how can you make this work for you? So again, in the 50 years that this technology has been studied, there's never been a recorded side effect. You couldn't hurt somebody with this technology if you tried. Can you imagine something like this that can do all these things and help people with so many things, and you couldn't hurt anybody? The worst that'll happen is nothing. Not like let's yank out this organ and see if that makes a difference. No, we're not
Right.
doing any of that stuff. So how does it work? There are two completely separate mechanisms. Most recently, within the last decade, they learned that there was an element from red light that helped with fat loss. Okay, we're going to put that aside for a second. No, you know what? So let's finish up because it's easy. Fat loss, they thought originally it was about melting fat, and that's why it helped people actually lose fat. That's not how it works. And this took a while for them to discover that small micropores, they're called transient micropores, are developed around the cell wall or of the cell wall of the fat cell. And it allows the contents to leak out. Every cell in your body is under a little bit of pressure. If you poke a little hole in it, the contents, some of the contents will leak out. And that's what they learned, is that transient series of transient pores on the fat cell walls allow the fat contents to leak out. And then with our protocol, we'll move that fat away from the fat cell, eventually to the liver for use or elimination. So that's fat loss. Okay, and that's red light. And red light, it does some healing, but it also does that fat loss. On the other hand is the near infrared. This is my baby. This is the one I love. This is the miraculous wavelength that doesn't do anything for fat loss, but it's beautiful for healing. It's gorgeous for healing. So how does that work? Now, of course, they didn't know in the beginning, 50 years when they started the technology studying it, they didn't know how it worked. What they have since learned is that it's all about the mitochondria. And they didn't even know back then that the mitochondria was so significant. When I went to school, we learned that there was one mitochondria in every cell. Well, what if I told you now that what they've discovered is that 10% of your body weight is made up of mitochondria? That's how important the mitochondria. And there isn't one in every cell. In some cases, there are over 5,000 mitochondria in every cell, for example, in the heart and other muscles. Muscle tissue has that much mitochondria because of the demand. So what is the mitochondria about? Mitochondria is this small organelle that's in every cell, many of them in every cell, that helps to create this very important molecule that gives life to your body called ATP. That ATP is stored energy. It's the reason why you breathe oxygen and eat food, to create these ATP. And you create a lot of ATP every day. In fact, your body weight in ATP every day. ATP is the difference between you being alive and healthy. And if you have malfunctioning or dysfunctional mitochondria, you're going to have disease and eventually death. So these lights stimulate the mitochondria, and it makes sense if you think about it. We're on this planet that has this yellow or orange thing, whatever you want to call that, called the sun up there. And the sunlight has elements. What we've done is we've extracted elements of sunlight, magnified it many times, and drive it into someone's body with no possibility of hurting them. Absolutely safe, absolutely natural. You're not putting anything in the body that doesn't belong there. You're not yanking anything out of the body that does belong there. And you're putting all this glorious energy into the body, stimulating the mitochondria to come back to life. It's not about an excessive amount of hormone, excessive amount of anything. It's about bringing the body back to normal. Mm-hmm. And that's it. It's just so simple, but it took a while for them to figure out it was all about the mitochondria. And so now they have books called mitochondrial dysfunction. They have diseases called mitochondrial dysfunction. They have all these different things. It's the beauty and glory of having knowing now that you can stimulate the mitochondria to come back to life. And that's how it works.
Yeah, and it's our mitochondria are constantly being shut off or turned off or declined just because of everyday stressors, our environment, toxins, you name it. So it's super important to what I like to call like recharge our batteries. And that's one of the main benefits.
The worst thing that anyone can have is getting older.
Right.
And as I see I'm getting older, I don't want, I know I'm going to get older, but I tell people it's like You want to age gracefully, not
Yes.
that the last 25% of your life you're in a wheelchair. I used to teach a class, will you be dancing when you're 80? There's a lot of people
Hmm.
dancing when they're 80, but if they were
Yeah.
to take care of themselves, including red light therapy and eating right and exercising right, not a lot of exercise, all the studies show that you can do it all in a half an hour, 3 times a week.
Hmm.
But of course, if you have the opportunity to walk instead of taking an escalator, or anytime you have a chance to move your body around, that's also very helpful. So it's
Right.
not just about any one thing, but it's also, you don't need all these toys if you don't want. Now, we've
Hmm.
paired this with hyperbaric chambers. We've paired this with different electro pulse waves and things like that. And that just makes it even better. But the
Yeah.
centerpiece of all this, I'm not telling chiropractors don't do their job anymore. You do it, but the bed becomes a major part of the practice.
Hmm.
Acupuncturists, naturopaths, just including this and not stop doing what they're already doing. It's
Yeah.
just a way of adding even more wonderful technology to their practice.
So I know we spoke before, but have you found or put a bed in Arizona yet?
I don't know that.
I don't, you said no, but that was a couple months ago. So I'm curious if that has, but yes, unfortunately there's none of your trifecta beds here in Arizona
A note here.
as of yet. So we can't experience it here in Arizona, but you did mention that there really are no side effects, but for your bed, how long of a session or how many times a week is recommended for your bed? And then also if someone we don't have access to your bed here in Arizona. So if someone has, a wall unit or a mask or a little handheld one that's obviously not as effective as a whole body approach, do you have a recommendation on time and frequency of the handheld or solo devices?
But I tell it, listen, I've used all those things. It just doesn't
Hmm.
do it. So they're fine. They're nice. They're fun. If you're in an area where we don't have a bed, just find a practitioner around there and tell them they got to get the bed. Get it in there. If you have an area, I'm pretty sure we do now have a bed in Arizona. So I'm going to do some research on that,
Okay, let me
and
know.
I'll get back to you about that. Um, we have a lot of people who have this thing called more wealth than health, and they just buy the damn thing for their
Hmm. Yeah,
home.
yeah.
I mean, you cannot put a price. Listen, I have to be careful what I say. I can't make, I'm not trying to create enemies with the medical world.
Yeah.
Um, but the truth of the matter is that one of my patients was very sickly, and they had ulcerative colitis, and it was constant diarrhea, and they were really doing poorly, and they put them on Remicade. Now, one dose of Remicade, one dose, costs $55,000.
Yeah, it's crazy.
So, I've had people who have had to take drugs that cost a fortune, and they don't need those anymore.
Hmm.
Whether it's kidney issue, we had this one lady. She had three forms of psoriasis. She had psoriatic arthritis, she had goutate, and she had plaque psoriasis, and it was ruining her life. Her forehead was all red and rash. She was bleeding from her ears, all over her extremities, and that stopped. Her psoriatic arthritis created such horrific pain in her joints. She would wake up in the morning with what's called dactylitis in her toes, which was like they look like black and blue and sausage, and it's coming out of the skin practically. So painful. She doesn't have that problem anymore. So, all I'm saying is that you want to bathe the entire body. If you're doing little areas of your body, that's fine, but it's not going to do what we now realize, bathing the entire body. The beauty of the trifecta light bed is that the lights come right down onto your body. The power is there without heat. Um, you can control the top canopy separate from the lower bed. So there are a lot of features. It's also very easy to get in and out of the bed. I've made this from scratch, so I made sure that it would work perfectly for people.
And how often do you recommend using the beds?
So the standard thing is when one of our practitioners is doing the consult. Thank you for keeping me focused on because I get carried. The practitioner is supposed to figure out what is the target. What are you here for today? And
Mm-hmm.
we figure out what the target is. and we're going to see you 3 times a week until we reach your target. That's the typical 12-minute sessions, 3 times a week till we reach your target. Now, there are some people who are in such severe, have such severe condition that we may have to see them every day. So, for example, someone came in with an open wound or a horrific third-degree burn. We've seen people respond so remarkably well. The skin is incredible. You know, anything on the skin, moles and any kind of acne, or like I already talked about psoriasis, even sagging skin and stretch marks, fine lines and wrinkles on the face will fade dramatically from this as well. So 3 times a week until we reach the goal, typically.
Yeah, fair enough. How long does the goals, like, are they, I mean, I'm sure it varies for everyone, but you said for some people it could be resolved in like one session, right?
Well, the word resolve, they will notice a difference. Typically within 2 weeks.
Improvement. Yes.
So, for example, that gentleman who had heart attacks, now his heart's, every organ and gland and tissue in his body was doing very poorly.
Yeah.
So I don't remember. I'm that's not my patient. I haven't been in practice for the last few years. I live vicariously through all the practitioners. There are patients who contact me all the time and tell me these amazing results. This lady over here has inoperable brain tumors and symptoms up the whatever, all kinds of symptoms, and all those symptoms are gone. But this is not my patient. This is what I'm hearing. This person over here hasn't peed normally for years because when she was a child, she had such horrible urinary tract infections that it ruined her entire system. And now she's peeing normally. So I live vicariously from all these wonderful things that are told to me and expressed. And I interview people all the time because I'm excited and fascinated about all these different conditions and all these things that people have. But again, 3 times a week until we reach your goal. It's 12 minutes a session. You ask how long. It could take, within 6 visits, you're going to see a difference.
Yeah.
There's one lady, they're talking about the fact that her Parkinson's was so severe that she couldn't go to church. This was her big disability. Obviously, she had many issues, but this was one that bothered her the most. When she went to church, she couldn't hold the Bible because her tremors were so severe. And after 2 weeks, the tremors are still there, but they were so much more mild that she was easily able to hold the Bible. Now, over the months, she got better and better, but she saw a difference within 2 weeks. It might take a month to see, but probably within 6 visits, that's 2 weeks. If someone gets in the bed after 6 visits and they don't see any difference, then it's probably not for them. And I've never heard of that happening. If awesome. They have a problem, I haven't really heard a lot about people who have gone 6 visits and don't see any change at all.
That's great. Well, Carl, we could probably speak about red light and light all day, but for the sake of time, I will wrap it up with one question I ask all of my podcast guests. What would be your best or favorite health tip that you can share with the audience?
I don't know. I'm going to give you 2. One of them is...
Get in the bed? Get in the bed!
One of my staff members made this up for me because I'm obsessed with this thing, and I apologize if I come across like I'm nuts. I love this stuff. But the other thing is, I also teach a class on how to sleep the right way. Most people don't sleep right. So let's say you were getting, bless you, let's say you were getting in the bed, but you went home and slept on the wrong bed with the wrong pillow and the wrong posture. Every morning, if you just did that once in your life, your body can easily, we call it mini traumas or micro traumas, the body can handle that. But your lifetime of screwing up. So I also teach people how to sleep in a semi-fetal position on your side. And the most important thing that people don't know about is putting a pillow behind them so that they're not on their shoulder, they're off their shoulder. It's like, we call it couch sleeping. If you slept on a couch with a back to it, you'd be leaning back onto the couch. That's what a lot of people who have back pain, they go and sleep on their couch.
Yeah.
I'm not recommending that. I'm not saying you don't ever have to sleep. You can't. But all you have to do is put a pillow behind your back. So that's a long-winded thing of telling you.
No, it's great.
There are so many things that I could tell somebody But get in the bed and sleep better.
Well, in 145 episodes, nobody has ever said get in the bed. So you win for that. And sleep, I think, has come up, but not that sleep tip. So I really appreciate that because back pain is a huge issue. So those were good tips. Thank you so much for sharing. But as always, I really appreciate your time and your knowledge and expertise in this area. Let me know if you have a bed in Arizona so we can include the location in the show notes. And I'm going to keep my ears and eyes open for someone. I don't have space in my office for one because I'm sure listeners in Arizona that are going to reach out to me and be like, well, you, Dr. Erin, get one in your office. Well, I don't have space, but I will definitely keep my ears and eyes open for someone that might have space to get one of your beds local here to Arizona. But again, thank you for taking your time, and I appreciate you being on the show. Yes.
Before I go. Okay, so we talked about my book, but also if they go to trifectalight.com.
Okay.
There's a lot of good information there.
Perfect.
And under the more section, there's flip books. There's all kinds of stuff that they can learn about.
Awesome. Well, we will make sure to put that link in the show notes as well. And again, thank you for your time, and I appreciate you being on. Thank you so much for listening. Make sure to like, share, subscribe, and leave a comment below. And if you haven't done so, please be sure to give us a rating on your favorite podcast platform. Join us weekly as we inspire you to be your best version. For more, follow me on Instagram at dr.erinellis. Until next week, you got this.